Have you ever walked into a room and completely forgotten why you went there? Or maybe you struggle to remember where you put your keys, even though you just had them in your hands? Forgetting things every now and then is completely normal, especially as we age. But when memory loss starts interfering with your daily life, it could be something more serious. Here's the scary truth. Over 6 million Americans are currently living with Alzheimer's disease, and that number is expected to double by 2050. Even more alarming? Many people ignore the early warning signs, only to realize something is wrong when it's too late. Alzheimer's disease is a progressive, degenerative brain disorder that affects memory, thinking, and behavior. It doesn't happen overnight. Instead, it slowly creeps in, disguising itself as just getting older. But if caught early, its progression can be slowed, and in some cases, quality of life can be significantly improved. So, if you or someone you love is experiencing any of these symptoms, don't ignore them. Early detection can save years of independence and allow for better treatment options. Let's dive in. 1. Memory loss that disrupts daily life. Everyone forgets things sometimes, but if you or a loved one regularly forgets important information, like appointments, conversations, or even the names of close family members, it could be an early sign of Alzheimer's. Normal forgetfulness versus Alzheimer's-related memory loss. Normal, occasionally forgetting a name but remembering it later. Alzheimer's, forgetting names entirely, even of close friends and family. Normal, walking into a room and forgetting why you went in. Alzheimer's, getting lost in familiar places like your own neighborhood. Normal, occasionally misplacing your phone or glasses. Alzheimer's, losing items and putting them in strange places like putting keys in the fridge. Example. Imagine your mother asks the same question 3 times within 30 minutes because she doesn't remember asking it before. Or your dad tells you the same story over and over again, completely unaware that he already shared it. What to do? Keep a journal of memory lapses. Track how often they happen. Encourage a doctor's visit. Don't wait until it gets worse. Write reminders and set alarms, but if forgetfulness continues, seek medical advice. 2. Trouble with planning and problem solving. Struggling with simple math, unable to follow a familiar recipe, losing track of bills. These could be early signs of cognitive decline. Watch for these signs. Forgetting how to do basic tasks like balancing a checkbook. Having difficulty following a familiar recipe, even one they've made for years. Getting confused with numbers, like forgetting how to calculate a tip at a restaurant. Trouble making plans, even something as simple as setting a doctor's appointment. Example, your grandmother has been making her famous lasagna for 30 years, but suddenly, she forgets key ingredients and can't remember the next step. It's not a one-time mistake. It's happening more and more often. What to do? Encourage simpler, step-by-step instructions for tasks. Watch for continued struggles. If problem-solving keeps declining, seek medical help. 3. Mood and personality changes. One of the most heartbreaking changes in Alzheimer's is how it affects personality. Signs to watch for: sudden anger or frustration over small things. Anxiety or paranoia, like accusing family members of stealing. Depression and withdrawal from favorite activities, becoming suspicious of loved ones. Example. Imagine your father, once calm and easygoing, suddenly becomes aggressive over minor inconveniences, like misplacing the TV remote. He starts accusing your mom of hiding things, even though he's the one forgetting where he put them. What to do? Be patient and reassuring. Don't argue or correct them. Speak to a doctor if behavior changes worsen. Alzheimer's can affect vision, making reading, judging distances, or recognizing faces difficult. Watch for these signs. Difficulty reading words or following a line of text, misjudging distances like tripping over stairs or curbs, confusing reflections in mirrors and not recognizing familiar faces, even close family members. For example, your grandfather, once an excellent driver, suddenly has multiple fender benders and struggles to park, even though he's been driving for 50 years. So, what to do? Schedule regular eye exams to rule out vision issues, and if driving becomes unsafe, consider alternative transportation options. Struggling with words in conversations. Forgetting words occasionally, that's normal. But if someone consistently has trouble finding the right words, it could be Alzheimer's. Signs to watch for. Forgetting simple words. Saying the thing for cutting paper instead of scissors. Pausing mid-sentence and forgetting what they were saying. Repeating themselves frequently in the same conversation. Example, your aunt used to love telling stories, but now she stumbles over words, loses her train of thought, and gets frustrated when she can't finish sentences. What to do? Be patient. Don't rush or interrupt. Encourage writing things down. Loss of interest and motivation when the spark fades. Have you noticed a loved one gradually losing interest in things they once loved? Maybe they used to paint, garden, or read, but now they can't seem to find the energy to engage in their favorite hobbies. This could be more than just a bad mood or stress. It could be a sign of Alzheimer's disease. When Alzheimer's affects the brain, it disrupts motivation and enthusiasm. Everyday activities that once brought joy and fulfillment start to feel like exhausting chores. This loss of motivation isn't just about feeling lazy, it's about neurological changes that make it difficult for the person to find pleasure in life. Warning signs to watch for: sleeping more than usual. They spend most of the day in bed, even if they were once active. Losing interest in hobbies, books remain unread, knitting projects go unfinished, gardens are left to wither. Skipping basic hygiene routines, showering less often, forgetting to brush their teeth, or wearing the same clothes for days. Ignoring household chores, laundry piles up, dishes remain unwashed, and the home becomes cluttered. Not responding to invitations. They stop attending family gatherings, community events, or outings with friends. Example: imagine your mother, who loved gardening for years, suddenly stops tending to her plants. She lets them wither and die, no longer caring for them like she used to. Instead of spending time outdoors, she stays in bed for most of the day, rarely showing excitement about anything. When family members ask her if she'd like to take a walk or visit the park, she simply shrugs and says she doesn't feel like it. What's happening? Alzheimer's affects the brain's reward system, making it difficult to experience pleasure and motivation. The person may want to do things but feel mentally unable to start. This can lead to depression, isolation, and further cognitive decline. What you can do: encourage small activities. Start with something simple, like listening to their favorite music or taking a short walk. Don't force them. If they resist, try suggesting activities gently and positively. Establish a daily routine. Consistency helps reduce confusion and increases a sense of control. Monitor for depression. Loss of motivation could also be a sign of coexisting depression, which can be treated with professional help. Consult a doctor. If they show persistent loss of interest, it's essential to discuss these changes with a healthcare professional. Withdrawing from social life. When conversations become overwhelming. We all enjoy a little alone time now and then, but if a loved one starts completely withdrawing from social interactions, avoiding family, friends, and even phone calls, it could be an early sign of Alzheimer's disease. Social interactions require memory, focus, and quick thinking, all of which are affected by Alzheimer's. People with early Alzheimer's may feel embarrassed or frustrated when they struggle to follow conversations. Instead of asking for help, they may choose to withdraw entirely. Signs to watch for: skipping family gatherings. They avoid birthdays, holidays, and dinners, even though they once loved these events. Forgetting plans. They say yes to a lunch invitation but completely forget to show up. Becoming quieter in conversations. They struggle to keep up with discussions, so they stay silent. Making excuses to avoid visitors. They insist they're too tired or not feeling well even if they're home all day. Losing interest in friendships. They stop calling, texting, or reaching out, even to close friends. Example: your dad, who used to love chatting with neighbors and playing cards with friends, suddenly stops attending gatherings. When you invite him to a family dinner, he says he doesn't feel like going. Even when friends call, he lets the phone ring without answering. Conversations that used to be fun and lively now feel exhausting for him. What's happening? The cognitive decline caused by Alzheimer's makes social interactions difficult and overwhelming. They may struggle to remember names, lose track of conversations, or have trouble finding the right words. Rather than face embarrassment or frustration, they choose isolation instead. What you can do: encourage one-on-one conversations. Group settings can be overwhelming, but a quiet, private chat might feel easier. Make socializing stress-free. Keep conversations simple and pressure-free. Use familiar topics. Talk about their favorite pastimes, hobbies, or memories to keep them engaged. Be patient and reassuring. If they struggle to communicate, avoid correcting them and gently encourage them to continue. Suggest low-stress social activities. A short walk, watching a favorite movie, or listening to music together can help them stay connected. Why this matters: social withdrawal speeds up cognitive decline. Studies show that loneliness increases the risk of Alzheimer's-related decline. Staying socially engaged, even in small ways, can help slow the progression of memory loss. Final thoughts: don't ignore these signs. Alzheimer's disease is often dismissed as normal aging, but it's not just forgetfulness. It's a progressive, degenerative disease that must be caught early for the best chance at treatment and care. If you or a loved one is experiencing any of these symptoms, seek medical advice immediately. Early intervention can slow progression, improve quality of life, and give families time to plan for the future. Remember the FAST method for early detection: face drooping. One side of the face may appear droopy or unresponsive. Arm weakness. They may struggle to lift or hold things. Speech difficulty. Conversations become harder, and words are frequently forgotten. Time to call a doctor, the sooner the better. Have you noticed these signs in someone you know? Drop a comment below and share your experience. Your story could help others recognize the warning signs. Like and subscribe for more life-changing health tips. Turn on notifications so you never miss an important update.